If you are over 65 and you keep several prescription bottles in your kitchen, this conversation could be one of the most important health discussions you hear this year. Not because every medication is dangerous, not because your doctor made a mistake, but because the heart you have today is not the heart you had 20 years ago. As we age, the heart loses reserve, flexibility, and its ability to compensate for stress. A side effect that barely affects a younger adult can become a serious burden for an older heart. I am Dr. Kevin, and after more than 20 years of working with older adults, I have seen the same pattern repeat itself countless times. People assume that taking medication exactly as prescribed automatically guarantees safety. In many cases, it does help. But sometimes the greatest danger comes not from a disease but from the interaction between aging and treatment itself. The warning signs rarely begin with dramatic chest pain. More often they begin quietly: swollen ankles, unusual fatigue, dizziness, shortness of breath, or a strange flutter in the chest. Families often blame these symptoms on getting older, but sometimes the real trigger is hiding in plain sight inside the medicine cabinet. The goal today is not fear, the goal is awareness, because protecting your heart starts with understanding the risks that often go unnoticed. Let me tell you about William. His name has been changed, but the story is real. William was 72 years old and struggled with arthritis in both knees. Every step hurt. Walking to the mailbox felt like a challenge. His doctor prescribed an anti-inflammatory medication, something millions of older adults use every year. At first, the results seemed wonderful. His pain improved, he slept better, he moved more freely around the house. To William, the medication felt like a success story. But while his joints felt better, something else was happening behind the scenes. Anti-inflammatory medications can cause the body to retain salt and fluid. That extra fluid increases the workload on the heart and can raise blood pressure. William didn't notice anything at first, then his shoes started feeling tighter. A few weeks later, he became short of breath while climbing stairs. Soon he needed extra pillows to sleep comfortably at night. Eventually, his daughter rushed him to the hospital because he could barely catch his breath. Fluid had begun accumulating in his lungs. His heart was struggling to keep up. The medication didn't create the problem alone, but it pushed an already vulnerable system past its limit. That is how medication-related heart problems often develop: quietly, gradually, and without obvious warning. The lesson from William's story is not that pain medication is bad. The lesson is that older adults must watch for the signs that the heart is becoming overloaded. Unfortunately, many people focus only on whether their pain improves. They ignore the clues their body is sending. There are 4 warning signs every older adult should remember. The first is swelling, especially around the ankles, feet, or lower legs. The second is shortness of breath that seems new or unusual. The third is unexplained fatigue, where simple tasks suddenly require more effort than before. The fourth is rising blood pressure that becomes harder to control. These symptoms may seem unrelated, but together they often signal that the heart is carrying more strain than it should. One of the biggest mistakes older adults make is assuming that over-the-counter medications are automatically safe. Many people keep ibuprofen or naproxen nearby just in case, but just in case use can slowly turn into everyday use. Before anyone realizes it, a medication taken occasionally becomes a daily habit, and daily habits can create long-term stress on an aging heart. That's why every medication deserves periodic review, especially after age 65. The body changes, and the safety profile of a medication can change along with it. Now let's talk about Dorothy. She was 68 years old and had lived with high blood pressure for years. She followed instructions carefully, took her medication every day, and rarely missed a dose. Her numbers looked good on paper, but gradually she started noticing something strange. She felt exhausted by midday. Shopping became harder. Her legs felt unusually heavy. Then one afternoon, while standing in a grocery store, she suddenly fainted. Medical testing revealed that her heart muscle was weaker than expected. One possible contributor was a medication from the calcium channel blocker family. Now this is important. Not every calcium channel blocker is dangerous. Many are effective and appropriate, but certain medications in this category can reduce the force with which the heart contracts. For a strong younger heart, that reduction may not matter much. For an older heart already operating with limited reserve, it can make a significant difference. Dorothy never felt her heart weakening. She simply felt tired. That's what makes these situations so difficult. The symptoms often appear ordinary. People blame age, stress, weather, or poor sleep. Yet beneath those everyday explanations, the heart may be struggling. Sometimes what looks like normal aging is actually a medication issue waiting to be discovered. One of the most dangerous phrases older adults hear is, "You're just getting older." While aging certainly changes the body, that explanation can sometimes stop a deeper investigation from taking place. Dorothy was told her symptoms might simply be part of getting older, but her body was trying to communicate something more important. The problem wasn't age alone. It was the interaction between age, heart function, and medication. This is why older adults should ask a powerful question during every medication review. Is this drug still the best choice for my heart today? Notice the wording, not 10 years ago, not when the prescription was first written. Today, because your heart today is different from the one you had a decade ago. Kidney function changes. Hydration changes, muscle mass changes, circulation changes. The practical lesson here is not to fear blood pressure medication. These medications save lives every day. The lesson is to make sure the treatment still fits the person taking it. Medicine works best when it is individualized. A prescription that was perfect years ago may deserve reconsideration now. The goal is not fewer medications at any cost. The goal is the right medications for the body you have today, and that conversation could prevent months or even years of avoidable heart strain. James was 76 and had struggled with acid reflux for years. The burning sensation after meals was miserable. Like many older adults, he was prescribed a proton pump inhibitor, commonly known as a PPI. These medications can be very effective. For many people, they provide genuine relief and improve quality of life. But James stayed on the medication not for weeks or months, but for years. Over time, something important began happening beneath the surface. Stomach acid does more than create discomfort. It also helps the body absorb key nutrients, including magnesium. When stomach acid remains suppressed for long periods, magnesium levels can gradually decline. The problem is that magnesium plays a crucial role in heart rhythm stability. Magnesium can lead to palpitations, skipped beats, muscle weakness, fatigue, and even atrial fibrillation. James eventually developed a persistent irregular heartbeat. When his medical team reviewed the bigger picture, long-term acid suppression became an important concern. The medication was not the only factor, but it contributed to the problem. This is why medications that seem harmless deserve periodic review. The fact that a drug helped years ago does not automatically mean it remains the best choice today. Older bodies change, and medication plans must evolve as well. One of the biggest dangers in healthcare is something I call invisible medication. At first, a prescription feels important because it solves a problem. Over time, however, it becomes part of the furniture. You stop thinking about it. Your doctor may assume another physician is monitoring it. Another physician may assume it was reviewed elsewhere. Years pass, the medication remains, the patient changes, but the treatment stays exactly the same. That is how risk accumulates. The truth is that no medication should become invisible after age 65. Every prescription deserves occasional reevaluation. The kidneys change, the liver changes, hydration changes, heart function changes. A drug that was perfectly appropriate at age 60 may create challenges at age 75. Unfortunately, healthcare today is often fragmented. One doctor manages blood pressure, another handles arthritis, another treats reflux, another focuses on sleep. Each specialist sees a piece of the puzzle, but the older heart experiences the entire puzzle at once. That is why medication reviews are so important. The greatest risk often comes not from a single prescription, but from several medications interacting inside an aging body. The first medication group that deserves careful review is nonsteroidal anti-inflammatory drugs, often called NSAIDs. These include common names such as ibuprofen, naproxen, and diclofenac. Millions of people use them for arthritis, back pain, headaches, and joint discomfort. The problem is that these medications can cause the kidneys to retain sodium and water. More sodium means more fluid. More fluid means more work for the heart. Blood pressure often rises at the same time, creating a double burden. For a younger adult, this may not create noticeable symptoms. For an older adult with limited cardiovascular reserve, the effect can be significant. That is why swelling, weight gain, and shortness of breath should never be ignored. If you use these medications frequently, ask your doctor a direct question. How much is too much for my heart? Many people assume over-the-counter medications are automatically safe because they do not require a prescription. That assumption is dangerous. The body does not care whether a drug came from a pharmacy counter or a prescription pad. It only responds to what that chemical does inside your circulation. The second group involves certain calcium channel blockers, particularly medications such as diltiazem and verapamil. These drugs can be extremely useful for blood pressure management and some heart rhythm conditions. However, they can also reduce the force with which the heart contracts. In a healthy heart, that reduction may not create a major issue, but in an older heart already functioning at reduced capacity, weaker contractions can mean reduced blood flow throughout the body. Patients may experience fatigue, dizziness, weakness, exercise intolerance, or even fainting episodes. What makes this tricky is that the blood pressure numbers may actually look better. A patient sees an improved reading and assumes everything is fine. Meanwhile, their stamina declines and symptoms worsen. That is why numbers alone never tell the whole story. If you take one of these medications and feel worse despite improved blood pressure, ask whether your heart function has been reassessed recently. Ask whether the medication still matches your current condition. The goal is not to fear treatment. The goal is to ensure that treatment supports the entire body, not just one measurement. On a chart. The third group includes proton pump inhibitors such as omeprazole, pantoprazole, and esomeprazole. These medications help millions of people manage acid reflux and stomach irritation. The concern is not short-term use. The concern is long-term use without periodic reassessment. As discussed earlier, chronic acid suppression can interfere with magnesium absorption. Magnesium is essential for healthy nerve function, muscle contraction, and heart rhythm stability. Low magnesium levels may contribute to fatigue, muscle cramps, weakness, palpitations, and irregular heart rhythms. The practical question is simple. If you have taken one of these medications for years, ask whether it is still necessary. Ask whether magnesium levels should be checked. Ask whether a lower dose or alternative strategy could be appropriate. Many people continue taking these drugs simply because nobody ever revisited the original prescription. That is not good medicine. Good medicine evolves as the patient evolves. The body you have today deserves a fresh evaluation, especially if a medication has quietly remained part of your routine for many years. The fourth medication group includes thiazolidinedionase, particularly pioglitazone and rosiglitazone. These medications can improve blood sugar control in some individuals, but they also carry a known risk of fluid retention. That phrase sounds harmless until you understand what it means for an aging heart. Extra fluid increases circulatory volume. The heart must work harder with every beat to move that additional volume throughout the body. Over time, symptoms such as ankle swelling, rapid weight gain, and worsening shortness of breath may appear. For patients with existing heart failure or borderline heart function, these changes can become serious. The key is awareness. If you take one of these medications and notice swelling or breathing changes, mention the medication by name during your appointment. Details matter. The more specific you are, the faster your healthcare team can identify potential causes. Many medication problems remain hidden because patients describe symptoms without mentioning the treatments that may be contributing. Older adults deserve a medication plan that balances blood sugar control with cardiovascular safety. The fifth group includes tricyclic antidepressants such as amitriptyline and doxepin. These medications are sometimes prescribed for depression, sleep difficulties, chronic pain, or nerve-related symptoms. While they can be helpful, they also affect the heart's electrical system. Specifically, they may prolong something called the QT interval, which influences how the heart resets electrically between beats. You do not need to memorize the terminology. What matters is understanding that certain rhythm disturbances become more likely when electrical timing becomes unstable. This risk becomes even greater when multiple medications interact. Remember, older adults are rarely taking just one prescription. They are taking combinations. A medication that appears safe by itself may become risky when combined with several others. That is why medication reviews should focus on the entire regimen rather than individual drugs in isolation. If you take a tricyclic antidepressant, ask whether an electrocardiogram is appropriate and whether safer alternatives exist. Never assume that a medication remains ideal simply because you have been taking it for years. Sixth medication is dronedarone, a drug used to manage certain heart rhythm disorders. Many people assume that because it treats rhythm problems, it automatically protects every aspect of heart health. Unfortunately, medicine is rarely that simple. In some patients, particularly those with a history of heart failure, dronedarone may actually worsen overall outcomes. This illustrates a crucial lesson. A medication can target the correct symptom while still being the wrong choice for the entire patient. Good medicine requires looking beyond the immediate problem and considering the whole cardiovascular picture. If you or a loved one takes dronedarone, ask whether heart failure has ever been part of the medical history. Ask how the medication is being monitored. Ask what symptoms should prompt urgent evaluation. These are not difficult questions, but they can reveal whether the treatment still aligns with the patient's current condition. The best healthcare conversations are often the ones patients never realized they had permission to start. Now we arrive at the most important lesson of all. The greatest medication risk is often not a single drug. It is an unreviewed combination of drugs. One medication may cause fluid retention. Another may reduce heart contraction strength. Another may lower magnesium. Another may stress the kidneys. Individually, each effect appears manageable. Together, they create a significant burden. The older heart does not experience medications one at a time. It experiences them all at once. That is why some patients appear stable during a routine appointment and then end up hospitalized weeks later. Healthcare systems often review prescriptions in fragments. Your body lives them as a bundle. The older the patient, the more this distinction matters. This is why complete medication reviews are so valuable. Every prescription, every supplement, every pain reliever, every sleep aid, everything on the table together, that single step can reveal interactions and risks that remain invisible when medications are reviewed separately. Before your next appointment, place every medication you take on a table. Prescriptions, over-the-counter drugs, vitamins, supplements, sleep aids, pain relievers, everything. Then write down 3 simple answers for each one. Why am I taking this? How long have I been taking it? What changed after I started? This exercise often uncovers surprises. Many people discover they no longer remember why a medication was prescribed in the first place. Others realize that a prescription has remained in their routine long after the original problem disappeared. Take that list to your next appointment and ask for a complete cardiac risk review. Ask whether NSAIDs, calcium channel blockers, proton pump inhibitors, diabetes medications, antidepressants, or rhythm drugs deserve reassessment. Most importantly, ask this question: which combination of medications creates the greatest heart risk for me personally? That one question can transform a routine visit into a meaningful conversation. Remember, the goal is not fewer pills. The goal is smarter treatment, the right medication for the right patient at the right stage of life, because the heart you have today deserves care based on today's reality, not assumptions from 10 years ago.